Hello everyone, welcome back to the surgical canvas. In this video, we will be discussing about the Pruzansky classification. Pruzansky classification is used to assess the severity of the mandibular and temporomandibular joint deformities in patients with craniofacial microsomia. In grade 1, there is mild hypoplasia of condyle and ramus, and rest all the structures are normal. In grade 2A, there is absent glenoid fossa. This is the glenoid fossa which is absent here in grade 2A, but the mouth opening is symmetric and the TMJ, temporomandibular joint, is at normal position. In grade 2B, there is asymmetric mouth opening and there is abnormal placement of the temporomandibular joint. In grade 3, there is absent temporomandibular joint and there is severe mandibular hypoplasia. The hypoplasia is so severe in grade 3 that it can lead to upper airway obstruction.